So the ENESTop trial has been now running. We now have an update which is 144 weeks, so that's quite a substantial follow-up now. The question we're asking in that study is whether patients who have not achieved a deep molecular response on imatinib and have switched across to nilotinib and subsequently achieved a deep molecular response, or MR 4.5, whether they can then go on to successfully stop therapy. So the design of the study is that once patients are enrolled, they need to maintain MR 4.5 for 12 months, and around about 77% of the patients did maintain MR 4.5 for 12 months and were able to stop. And we presented the data before, but now we update up to almost 3 years, and we have a rate of success, that is treatment-free remission, of about 50%. Which is very significant given that these patients were not getting, in many cases, great responses to imatinib, needed to switch to nilotinib, and then achieved a deep response. This is a big question for a lot of clinicians, whether these sort of patients that have struggled to get good responses on imatinib will ever get to treatment-free remission. Well, we now have some pretty positive results in quite a large cohort of patients, showing that if you can induce a deep response on their second-line drug, it's very reasonable to proceed with an attempt at treatment-free remission. Not a guaranteed success, but it's a 50% success rate, as we see from other studies. The other critical findings in the ENESTop study that really should reassure physicians are firstly that we've had no CML-related deaths, no cases of accelerated phase or blast crisis in the entire study. Secondly, those patients that had to restart the nilotinib, and that happens in about 50% of the patients, 93% overall have gone back into the deep response that they had before, that is MR 4.5. We still have some patients who don't get to that very, very deep level, but the vast majority go back to where they were. So the risk involved in an attempt at stopping is only in terms of the uncertainty of the attempt at stopping. It's not in terms of being able to maintain deep response if they go back on drug. It's not in terms of loss of control of their disease. These are important, reassuring findings from ENESTop.